SEEEPHI. Okay. Okay. And I just have to agree to the recording. So the organization that I represent, the Association of Schools of Public Health in the European region, known as ASFER, is a membership-based association which brings together schools of public health from across the World Health Organization European region. Founded in 1966, the association is currently present in 43 out of 53 European countries with over 130 members. Since we have Croatia with us today, we also have Andrea Stamper School of Public Health in Zagreb as one of our members, so you're represented as well. Israel is the southernmost reaches of the European region, WHO European region, and we're proud to count 4 Israel institutions as members: University of Haifa, Ashkelon Academic College, Hebrew University of Jerusalem, and Ben Gurion University of the Negev. Israel has always held a special place with ASFER, being consistently at the forefront of ASFER leadership and agenda. And ASFER has been lucky to have had 3 representatives from Israel on the ASFER Executive Board, Professor Ted Tolchinsky and Professor Yehuda Newmark in the past, coming from Hebrew University. And currently Professor Nadav Davidovich from Ben Gurion University, who has just been re-elected for a 2nd term. And you can see here also the other representatives to the board, which represents a good spread across the European region. ASFER and our members are collectively committed to improving and protecting the public health by strengthening education and training of public health professionals for both practice and research. The 2 key functions of ASFER under that mandate is to support the professionalization of the public health workforce and to sustain capacity building in public health so that it balances with national and European population health challenges and threats. Okay. To do so, we are supported by the best standards of public health education and training, scientific research and practice. And to meet public health capacity building and professionalization goals, we turn to the roadmaps as tools to guide efforts. And these are in line with our partnership with the World Health Organization, both of the European and at the global level. The roadmaps work on key professionalization levers, which you see here on the left. To ensure that we have a recognized workforce, which is competent to deliver essential public health services. The SEEEPHI project focuses mainly on the first 3 levers: the competencies in public health training and education, and formal organization. SEEEPHI aims to enhance the public health workforce capacity in Israel through sharing European educational experience, including harmonization of different levels of public health education with workforce needs, improved employability of public health graduates by matching training to capacity needs required by employers, and providing career clarity and career development paths. Also through enhanced leadership skills for graduates through interactive problem-based and simulation learning, and through outreach to employers and the workforce to identify and organize the professionals who make up the public health workforce for improved public health and accountability. With the ASFER as coordinator, the project unites our 4 Israeli members, along with the Israeli Association of Public Health Physicians, with 4 EU-based member schools: University College Cork in Ireland, Maastricht University in the Netherlands, Jagiellonian University in Krakow, Poland, and Swedish Red Cross University in Stockholm. Based on the strengths of each partner, SEEEPHI pairs up European Union and Israeli partners to lead in the 5 work packages to address the 5 project objectives of the project. Each of the objectives are supported by an EU-developed tool, and they include the detailed analysis of field qualifications in the Israeli public health system. This is work package 2 run by ASFER and Ashkelon Academic College. Work package 2, mapping of competency profiles of Israeli schools and programs of public health to guide harmonization. This was University College Cork and Hebrew University. Work package 3, introduction of a dynamic online interface to enable public health education and workforce collaboration to support employability and continuing professional development. This is Jagiellonian University and University of Haifa. Work package 4, building leadership capacity via cutting edge training in schools of public health in Israel. University of Maastricht and Ben Gurion University are leading on this package. And stakeholder engagement to secure key outreach, which included Swedish Red Cross University and the Israeli Association of Public Health Professionals. The SEEEPHI partners have all been making great strides on these project objectives. However, the Erasmus capacity building funding is a starting point for SEEEPHI initiatives. It'll require the continued interest of the Israeli schools, the Association of Public Health Physicians, and the committed engagement of the stakeholders joining us today to ensure the long-term success and sustainability of the project outcomes in Israel. You'll hear soon from partners about the novel SEEEPHI products, and we trust that you'll agree on the importance to continue them going forward as an investment in a workforce that is so critical to the health of the Israeli population. I can already speak to ASFER's plans to see the outcomes of the SEEEPHI project flow back to the association's broader membership, and we expect to take the tools and lessons learned in Israel to implement similar actions in other countries in Europe and beyond. Our former president, John Middleton, is fond of saying that every country needs a SEEEPHI. And so just to say, I want to give my great thanks to the Erasmus office in Israel for all your support and for arranging the meeting today. And thank you to everyone who's attending, who has an interest in SEEEPHI. I won't take up too much of your time so that you can hear more from the partners there in Israel on the ground and their work and their achievements. But I'm here if you have any questions. And thank you very much for your attention.
Thank you, Laurie.
Okay.
If you can stop sharing, thank you so much.
Yeah.
So Professor Mekori, as a former dean of Faculty of Medicine, you're probably much more familiar than many others that are here. Public health is now trying all over the world to find how to fight all the overwhelming responsibilities, burnout, and here we think that the role of the CHE, the Council for Higher Education, is so important to see how we can move forward with issues that we are discussing and present to you today, like leadership and how to do the outreach, public health in all specialties, including physicians suffering from shortage. And in a way, it's very even paradoxical that after COVID, people think that, okay, now everybody knows what is epidemiology, what is public health, but it created also lots of frictions. the people here from the Public Health Division in the Ministry of Health, of course, this is the bread and butter. They can also tell you about things that they're doing. And I think the question of sustainability and how we take the product that you're going to hear, and we would be very happy to have the Council for Higher Education as another platform that can help us. This was discussed in the past, but I think we didn't fulfill the potential of doing that, and we'll be happy to hear from you. What are your thoughts? So as mentioned, we started first with a very detailed analysis of what's going on in the field and how people that are working in the field, what their expectations from public health graduates. There are already several publications that emerge from that. And the other part, of course, is how schools of public health, what is the competencies that are leading. And here we'll be moving to Professor Yuda Newmark to tell us about their findings. I think maybe you need to share it.
I'll share it. Yeah.
Oh, okay.
This one?
Yes.
Okay.
But maybe the speaker, if you want, and next to the computer, so they can see directly the speaker. Oh, it's good.
No, they see from there.
This is the camera.
They see the camera is there.
Wait 1 minute.
Need to see. Close.
Okay. Yes. Can you see the slide?
Yes.
Great.
Okay, so thank you, Nadav and Lori, for putting this into context. Our work package was tasked with mapping the competency profiles of the programs that are provided at the master level and bachelor level in the schools of public health in Israel. The background, not happening.
You're not just saying that 10 minutes, okay? Yeah, even.
What? Try now? Okay.
So the background to this is beyond the SEEEPHI objectives is an article that came out a few years ago presenting the European, what's called the ethos, the essential public health operations that public health practitioners are expected to fulfill, and the Asper's profile of, or list of competencies that a graduate from a public health training program is expected to have in their toolbox. On bringing these two together, linking the training, the toolbox together with the tasks that a graduate is expected to carry out, is the framework within which we conducted our work. And it also highlights the complexity of the challenges that a public health practitioner is expected to address in her or his work. So I'm not going to go into describing the ethos, it's a whole nother presentation, but essentially these are the operations that a public health practitioner is expected to engage in. Everything from the what they call the intelligence or the research side of the monitoring, evaluation, and surveillance, to providing the services that allow public health to promote health and protect and prevent disease, and then the enablers, communication and research, workforce and governance, and we're focusing on, of course, the workforce. The ASPR list of public health competencies are divided into 6 domains that you see here. And each of these domains incorporates both what they call intellectual competencies as well as practical competencies. So here, as an example, are 30 competencies that are subsumed under the heading of social demographic determinants of health. And a public health graduate is expected to have at least some grasp and some ability in all of these 30, and this is just one of the indicators, one set of indicators. For instance, here, qualitative research designs. So a trainee in qualitative research designs is expected to know about these 15 different topics and be able to engage in them. So when we took what we did was we took the list of hundreds of these indicators, and because the list is so large, it's very difficult to work with and to assess. And what we did is we converted it into a list of 57 competencies that incorporate all of those in the list of the ASFR core competency list for public health professionals. It took quite a while to do this, and we hope we did it correctly. What we then did was we converted it to a data collection form, and we distributed this to the participating schools of public health and programs of public health in Israel, and asked them to complete for each degree that they provide, and PhD degree, a bachelor's in public health, and for each specialization or track, to map for each of these. Okay, I don't see the laser, but for each of the indicators that are on the left, for each of the competencies on the left, to address in how many courses or other experiences, training experiences, students are exposed to each of these competency domains. So we looked at core courses, elective courses, and how many of these courses address each of the competencies. We asked the focal person for each university or for each institution to give a ranking of to what extent each competency is covered, and we gave criteria for a 0 to 4 ranking. And then we asked also within the practical or applied learning, whether it's a master's thesis, a master paper, workshops, capstone projects, field work, internships, whatever, what competencies they had covered. And without going into too much detail with regard to all of the, and there are many details we can go into, I'm just going to focus here very briefly for a moment, looking at Hebrew University. The gray line on these spider graphs are all courses or core courses. And what you can see is that the 100% of the competencies are covered in our core curriculum, because Hebrew University's master's program has a very large percentage of their credits in core courses. We have fewer elective courses, and what we notice is that a student who just takes core courses is not exposed very much to public health ethics. We have an elective course on it, or we had an elective course on it, but as you can see in the blue line, ethics is very far from 100%, and only students who take the elective course. As a result of this finding, we instituted, as of next year, the ethics course is going to be a core course for all of our students. So already the findings from this project have practical implications in our curriculum, and I'm assuming in other curriculum as well. Here, for instance, we can focus in on public health, health promotion specializations. Each graph incorporates all of the schools, and here looking at the elective courses, and we can see here that across the schools there's quite a degree of heterogeneity with regard to the exposure that students get within the health promotion specialization of other competencies. So they're getting a lot of health promotion, but in some of the schools, because of the way their curriculum is structured, they're not getting a lot of other competencies covered. So the balance between core and elective courses is highlighted very clearly here across the schools.
You done? 2 minutes.
I'm done.
Okay, perfect.
I know.
No, I have for sure.
Here is a summary heat map of taking all the schools and programs, looking at the core courses and asking, I think there's a core, I can't really think there's a good, but it doesn't matter. What does a public health graduate take away in their toolbox when they complete their training? And as we can see here, some core courses. So some of the domains are very well in the green, very well covered. And then there are other domains such as economics and environment and policy, which are less well covered. And so students leaving our training programs overall from the core courses, because that's what everybody's exposed to, have less training in some of these domains.
This is the average of all institutions.
These are all the institutions combined. I can't move forward.
It's been almost my fault, sorry. Try now?
Okay, so basically, we find that the methods and socioeconomic status, whatever what we call SES or social determinants of health, are well covered. Environment and policy economics are less covered in our programs. There's quite a degree of heterogeneity across programs, and therefore there's quite heterogeneity in the toolbox that students take away. What three very quickly extensions that we worked on and we are working on. We mapped our findings to the ethos, and we looked at to what extent the programs are covering each of the ethos, and we see there are some ethos that are more well covered, 87% for surveillance because that's more related to research, and then things like advocacy and communication, only 43% are covered. So we've been mapping to ethos. This is work package 2, which we're not going to hear about, but that's the package that did a survey of employers and workforce needs. And here they found, for instance, that ethos 3, health protection, is very needed in health districts in the Shtota Briut. And down on the bottom, advancing public health research is what the schools of public health and research institutes need. We then mapped our findings onto the findings of work package 2, so we can see to what extent the schools of public health trainings are addressing the needs of the workforce in Israel. The strengths of this is that we've been able to identify the strengths and gaps and the structures of the different curriculum in the schools of public health and that are providing these programs. And it allows us to think about harmonizing our training and developing interinstitutional courses where each of us may not be able to address all of the competencies, but together we can start building courses and mapping the toolbox with the needs of the health workforce. Some caveats: we don't know to what extent students actually learned the messages and the information that we're trying to provide. We didn't look at the quality of the education or the coursework and the quality of the courses that the students get exposed to. And that's just sort of an impossible task. And people had to answer for entire programs and so on. So there's a certain degree of imprecision, which is always part of research. And the sustainability has been mentioned. We have to think about how we can think about sustaining this. So if we look at as Laurie pointed out, the aim of SEEEPHI to enhance public health workforce, we think that by addressing or identifying the gaps in the current public health training programs, we can do further steps in moving towards advancing the public health workforce in Israel and then beyond throughout Europe and the world. And I acknowledge here our partner with University College Cork in Ireland, who did this work with us. Thank you very much.
Thank you, Yehuda. I think what you saw here was also the interaction between the work packages. So work package 2 and 3 from the side of the universities and the side of the employers are very important. And we'll have time for discussion by then. We have some more short presentations. Haifa, we'll be moving to Haifa University. And here I would love also to hear later from the Minister of Health about their perspective.
I would just say that this platform was built after a very, very long journey, taking into consideration the standards of ASPR and SEEEPHI, trying to also take all considerations related to the presentation Yehuda just gave, and trying to cover competences needed for different professionals in public health. But we also wanted it to be friendly and useful. And I really appreciate the very hard work that our partners in Poland, the Julian University, did to actually construct in practice this platform. And Dana will present it now. Okay, so I'm really happy to present the online employment and education platform, and I just try to understand how I'm moving forward. I think it's.
Maybe you wait for her.
Okay, and so in our work package number 4, the University of Haifa collaborate with the Union University from Poland, and we aim to build an online employment and advanced education platform from the public health in Israel. And the platform's purpose are to provide general information on job in public health in Israel and to make job offer accessible to the Israeli students and graduates, and to enable officials in public health institutions to recruit employees. Our platform based on the previous work package and 3 main documents and the UASFER framework. We used it to map the professional roles in the Israeli public health system. As per European core competency list was used to mapping the competences profiles of the schools. And as per European public health reference framework was used to develop the online platform and to collaboration between education and training with practice and workforce. And all of this was to support employability. Another core aim of the SEEEPHI project is to increase leadership capacity, and we try to reflect it in the platform using 2 main programs, peer-to-peer learning and training creation. Actually, the platform serves both employees and employers. Students and public health professionals can find a perfect job matching their competencies. Employers can publish job offers, and higher education institutions can publish curriculums and additional courses. So how this platform works, let's take, for example, Guy Neer is 28 years old. He lives in Tel Aviv. He finished his MPH studies at the University of Haifa. His first degree is in nursing, so he works as a nurse, but now he wants to find his next job. And he scans this barcode as you can do right now, and he will get to the beta version of the platform. And first step is to sign up. You can, of course, change it to Hebrew if you want, but I will present it in English. And he needs to choose his profile. So a guy is PhD, public health professional or a graduate, and he will create his account by inserting email and a password. After he will enter his personal details and his school details, and then a list of all competencies where mapping will open, and Guy will need to tick those competencies he acquired during his studies and his current job. And that's it. He signed up, and then he will go to log in and to job titles, job offers, sorry. And Guy always dreamed to be a community health educator. He sees that it's located in Ramat Gan and it's close to Tel Aviv, so he's interested in this job. So he will click on details, and then he will see all the job description and data about salary if applicable, and all the data he needs to know. And then he will see the required competencies for this current job. And in the case he will notice that some competencies are missing, he has that opportunity to fill them, as I will show later. Of course, there are contact details, and
After it can go also to job titles is another feature. And under a job position or job title, there is a list of all required competencies for every job offer. For example, which competencies are it needs to be a health educator. And then it can go to courses, and under this feature, you will see all the courses that university or higher education institutions upload to the platform. And for example, is interested in the health effects of climate change. So you can see all the job description, and also to go to the syllabus. And then you will see the competencies you will acquire if you will take this course. And of course, the contact details. So Guy decided to create account, not to create account, to create contact with Ashkelon and to figure out about this course. Another thing, there is a place to update on hot topics in public health, and in this feature, the administrator can upload articles about hot topics in public health, for example, about COVID-19. And I want to finish with a citation from in-depth interviews we conducted with our alumni regarding the platform. And I think it's really reflects the importance of the platform. So I think it's the platform really relevant. What should be there? As we discussed earlier, what are the required knowledge, education, and experience, and what is the position type? I think it will be stunning. It's sorely missing. So I really want to thank all other work packages who put the theoretical foundation to construct the platform, and of course all the University of Haifa team, and special thanks for to Robert and Lori from SEEEPHI, and of course our outstanding partners from Jagiellonian University, Marius Lupalga, Stefan Jankowski, and Natalia Torres. And thank you for your attention.
Thank you, Dana. I know that the Ministry of Health people, including Sharon and Zohar, maybe need to leave soon. So I don't know, Sharon, if you are with us, and also Udi, we would love to hear your thoughts about this platform, and if it's feasible to think of for sustainability to adopt it. And Zohar is also going up to the airplane, so we'd love to hear also your thoughts and a few words about work package 2 before you go there.
Okay, thank you, Nadav. I'll do it very brief because can you hear me well, by the way?
Yes, we can hear you.
Good. I'll do it very brief for the sake of time, and also because I am not able to upload the presentation. But we did the work package 2 together with the Ashkelon Academic College, which is the only institution in Israel which provides first degree, bachelor degree in public health. We did it together with ASPER, with Robert and Lori. And what we did, we asked the employers what do they need in terms of public health qualification, which means we asked different employers, such as the Public Health Corps agencies. We ask other governmental ministries, health agencies such as the hospitals and HMOs. What do they need in terms of public health qualification in different levels, beginning, a medium level like a master's degree, and a higher level such as PhD. And it was very interesting to map the different qualifications which are needed in different organizations and by different qualification. We made a grid of the different needs and to continue with the entire project, then other work packages can use our results in order to go back to the university and shape and sharpen the target of the different courses in order to adapt it to the different needs of the different health agencies in the different level of qualification. Just to conclude, we published our findings because we had two kinds of survey. One survey was qualitative and the other one was quantitative, in which in one of the survey we actually interviewed opinion leaders, and we published it in two nice journals, and all the information is available. And thank you very much, and thank you for letting us participate in this beautiful project. That's it from my side.
Thank you, Zohar. Again, Udi, I see you. Maybe you have some thoughts about the platform and other things, because I know that you...
Yeah, thank you. A few words before I leave. The platform looks very good because I think it serves the purpose and it can really be helpful for all the professionals in this field to connect and to find a way. On the technical side, it's feasible and it's all matter again of money and human resources to manage it. I think there is a bigger questions regarding the policy, the role of the Ministry of Health. I mean, if the ministry job or responsibility is to manage in that way all the personnel in the country, I have to think a bit more about this question, but it's definitely a relevant question, and if Sharon is hearing us, I'm sure she has some thoughts about it.
Thank you. At least I presented very briefly this whole project in the strategic meeting, one of the strategic meetings that the Public Health Division had. So we need to continue this dialogue. I think it's very important. I don't know if the Council for Higher Education, since now we are dealing with the health workforce, physicians, but we have problems also with the public health part. So it will be interesting to hear what you have to say, probably less maybe on the technical platform, but other things that, thank you. Thank you, Udi. So now I will present briefly the issue of leadership that we think it's crucial. If you can, yeah, sure.
I just want to make sure we're going to have a practical discussion.
No, sure. We are. Yeah, I'll be very, very brief.
Okay.
I'll try to be.
Don't take your time. I just want to be sure that we get back to it. Otherwise, we have to say it now.
So you probably understand that in order to move with SEEEPHI, the issue of leadership is crucial. It's also part of the capacities. You can move to the next slide. You can see building leadership capacity via cutting-edge training in Israeli public health schools and programs, including peer-to-peer and train the trainers offerings. The project is done with the Ben-Gurion University School of Public Health is leading this together with Maastricht. Professor Karen Doppelt, she's here. She's leading it together with me from the Ben-Gurion side. And just a few days ago, we had an article that presents just the outline, how to move forward with that. Next slide. We are not, by the way, doing it from scratch. ASFER is dealing with public health leadership for many years. We developed a guide that the idea is to be used by all schools. Currently, Ben-Gurion University, Ashkelon already had it implemented into the programs. I'm working now with Haifa University and with Hebrew University, with Maureen and Yuda. If you can go ahead, the guide is including aspects of how to deal with leadership, definition, theoretical aspects, conflict resolution, ethical decision-making in health. Yehuda said that rightly that maybe we need to deal much more with public health ethics. I think especially with the current situation in Israel and the idea that we cannot stay just in our ivory tower and things that are happening now have a very deep influence on public health. Public health law, of course, is also very important. We're using PBL, and here we learned a lot from Maastricht, problem-based learning. We develop models regarding vaccine hesitancy. It's a major problem now during COVID, after COVID, and simulations. Next slide. So again, I'm just bringing some aspects about the issue of ethics and how it should be part of leadership. We start from values. Next slide. The PBL, we're probably very familiar. And here we learned that we visited Maastricht and learned from that. They have a whole faculty, Professor Mekori, a faculty of just doing PBL. It's amazing. I know that you're dealing with the reform in medical education, and we probably need to use it much more in general, not just in public health and medicine, many other places, especially in the age of AI and the CHE-PBC.
Changing the whole structure of medical school, isn't it?
Yeah, not just memorizing facts, but turning the students to much more active learners. Next slide. So again, you're probably very familiar with that. Next slide. And again, we use the vaccine hesitancy as a case study. And next. And we develop simulation. We have at Ben-Gurion University a very large simulation center that can be used not just for clinical simulation, but also for leadership simulations. By the way, you don't need a fancy simulation here. Sometimes even taking ambulances or what is most important by the literature is the debriefing afterwards and the learning mechanism. Yes, you can go. So we also develop scenarios about leadership in complex environments. This is just an example. It's about developing intervention on the city level, in our case, using the local context with Bedouin communities and lots of tensions, but it can be adapted to Haifa, for example, using your own context or Hebrew University. Next slide. And then another simulation that are more about ethical dilemma. In our case, it was the use of tracking by the security services. Usually the second simulation created much more intense reaction by participants. Next slide. You can see some of this was just a few months ago. Everything is videotaped, and you can annotate also during the simulation, make some comments. It's the whole machinery we have there. Next slide. And this is the article that was just published, led by Professor Karen Doppelt, also Professor Paul Barash, who is part of the external evaluation team. And you can see, next slide. We actually took this simulation and we used the mixed methods with questionnaires and also interviews, semi-structured interviews. Next slide. And we saw actually the themes that emerged. We use the called experimental learning cycle. I'm not going to delve too much into it right now. And it was showing the importance of using simulations in teaching leadership. Next slide. So it's a very powerful pedagogical training tool that we'll be very happy to work much more with the Council for Higher Education. And I think it can be developed into other fields as well. And the students were very, very happy with that. And it has a very strong potential to improve public health decision-making. That's something, if the Ministry of Health people are there, we'll be very happy also to work with them. I see that Zora is working there. Thank you. Okay, so We move now to the last presentation by Professor Chagai Levin.
So leadership is indeed crucial, and it's a pleasure to be here in this quiet and pleasant atmosphere. I want to say before we start about stakeholder engagement, and you asked, and we compared somewhat to medical students, of course, from your experience, Professor Mekori, and for some of us experience teaching medical students, we are in a crisis. We are in a crisis of the public health professional sector in Israel. We have a lack of personnel, a very severe lack, I must say, even more severe than the lack of physicians in Israel. The sector of public health, both in the specific professionals, meaning public health physicians, public health nurses, and other sectors, the situation is even worse than the general situation, which is very difficult for physicians and nurses, and even more for the other public health professionals. It's really what I will present it about stakeholder engagement, but one of the key stakeholders to engage is the Council for Higher Education, and we got the Minister of Health on board, which as we heard, understand the need to build the future work infrastructure in Israel for public health, and of course, together with all the schools of public health that actually train this future professionals.
Just if you can focus on how we can take part in employing, public health practitioners.
Definitely.
That's basically.
Definitely. So again, we have to shift gears in the sense to understand that public health is a profession. So unlike, I don't know, a master's degree in whatever, in physiology, or I don't want to harm anyone else, but here you have a profession. So exactly as medical school, nursing school, we have to plan together with all the stakeholders, what are the needs, and then to push people to choose this profession by not only specific campaign. I will speak about the marketing, but it's not only about the marketing, it's about the profession, what is the image of the profession and what is the salary of the profession. Nowadays, for example, in the governmental מכרזים, in the governmental tenders, there is many times there is no need specifically for a master in public health. So then people that are unprofessional for this specific task are winning the position. So we have to work together. Specifically, we have to support the School of Public Health in for example, what in other countries, they have allocation for the graduates, so they can follow them and help them. We also need to have practicum in our training, as was explained. We need the Council of Higher Education as one of the key stakeholders in finding the specific solutions for the training and then for working. So such as when I was in Mount Sinai, for example, in New York, they have very large organization to help the graduates to find proper jobs, and they have wonderful competencies to work because public health is our mission. And you need public health in many different sectors. So let's leave it for the discussion. We have some suggestions and we want to hear other suggestions. In this part, we want to speak about stakeholder engagement, and here Professor Rachel Dankner, who is maybe you present yourself because you didn't attend the beginning.
Yeah, okay, thank you, Chagai. I'm Rachel Dankner. I'm a full professor in School of Public Health in Tel Aviv.
I gave her professor.
So it's for the others in the room. I work in the Gertner Institute. I'm the head epidemiology of the institute, and I'm hoping we'll open a public health department in Tel HaShomer.
And the head of the curricular and the resident committee of the Israel Association of Public Health Physicians. So here we are from the association, together with the Swedish Red Cross University, Stephanie and Leah. And we also, for the stakeholder engagement, we work together with a marketing tools company. We established, which I will present, the public health influencers team, and work with all the CHE-PBC partners which were very informative in building this platform, and with the entire public health community, and we presented it in several occasions, such as the National Conference in Haifa and last year in Ashkelon. So our aim was specifically, we tried to be focused to expose relevant career education seekers to public health profession. What's need to be understood that graduate of every first degree is eligible to study public health, because in public health we need not only nurses and physicians, but also graduates of statistics and policy and geography and economics and law, which we don't have enough in Israel. We may need special programs for specific professions. We built upon a previous campaign called "This is Public Health." You can see here in the different languages that we tried. Oh. So, yeah, no, I don't know how to remove it. Okay. So when we look public health, we need all the different stakeholders, the researchers, the public health professionals, activists, journalists, decision makers, and the civil servants. We need all these to promote and protect the public health. We want candidates to join this coalition and to enforce it. As they come from the public, we need all the time to work with the public, because we take care of the public, so we need also to get the public engaged. It's very difficult because of the prevention paradox. People do not think about their health when they are healthy. So unlike, that there are like sick people groups that work for specific diseases, but not for the general public health. And although the COVID pandemic, exposed public health professionals, still not only in Israel, all over Europe and all over the world, we don't see the surge in people wanting to work in public health as we would have wanted to happen from the crisis. We have many challenges, and regarding the marketing, and I see it also in Erasmus, marketing and branding, again, it's difficult to market because of the complexity of the field. It's difficult to explain because of the serious public health profession struggles. We are attacked, and we want to congratulate Sharon. I don't know if she still sees us, but she just won a lawsuit against groups that attacks her, and it's very shameful how they did it, and she won. And we are in the front line, and we are working with politicians. We work in a very difficult atmosphere. We have low salary. In many times, we have, for our salaries, it's not well organized in general. So there is no attention to the needs of the public health professionals, and there are serious problems with the salaries. Just to tell, for example, for the public health physicians that work in the central district health offices, they don't even have lunch because it's not in the agreement, so they don't entitled for lunch. How to deliver the message? We have very wide target audience, so it's yes, we have the medical students and the nursing and the physicians and the nurses, that's clear, but we also want graduates of other programs, and it's difficult to get them. The ages are not only, like a strict age group, also elder people, 30, 40, even 50 sometimes do a career change to public health. It's difficult to know how to address them. We have very limited resources. Again, there is not specific resources for that. Unlike, for example, for medical schools and medical campaigns, we have tough image of public health professionals because we actually check that they not necessarily have the experience in marketing the profession. Some of them are shy. We have their own motivation. Would I recommend my own son instead of specifically my son, a 17 years old, brilliant student who can choose between whatever, but public health or medicine and computer science? Obviously for him, it would be much easier like to choose computer science. And so we have ambivalence of ourselves, how to attract the people. And I just attended a meeting of EUFA, and we are, the association is the official representative of Israel to EUFA, the European Union of Public Health Associations. And it was about communication, and someone said, the presenter said, communication is not our core business. I think that we need to make communication our core business because it's essential for public health. Ashkelon did not present their outstanding work package, but you can see here from the published paper that the issue of advocacy, communication, and social mobilization for health was the lowest. The highest gap was for this field of us, how to do advocacy communication. So we need to do better training and better job in that. I always ask, what do you read?
Opportunity is nowhere.
Said the pessimist.
Now is now here.
Opportunity is now and here, said the optimist. So we have an opportunity now because of the crisis, because of the the new normal, because of the post-pandemic. Also, I don't want to mix issues, but you see what I wear. We also have a crisis in the protection of health in Israel now, and this is an opportunity to work together for physicians and nurses and professionals that are more committed to the general. And you know, in the end, when we are at times of CHE-PBC and artificial intelligence, people search for meaning. And that's what we provide. Public health, we call you also to come to public health, but that's what we provide, because we provide meaning because we care about society in general. In our campaign, we realized that we want to get people that want to influence, that want to be leaders. That's what the kind of people we want to get. Yeah, there are different kinds of public health professionals, but the ability to influence, that's the key message. That's the kind of DNA that we want in public health. We also want diversity. We want people from all the populations. We established a forum together with the ultra-Orthodox community in Israel, and we know that we need much more students from the Orthodox community, from the Arab community, from minorities in Israel. So you can see here we shoot films. We shoot films for the communication, and maybe just very shortly, maybe we can show. Shira doesn't like represented.
Close your eyes.
Also my ears.
כל הנושא של גרים ושל תו ירוק ושל החלטות על תעדוף מטופלים וטיפול נמרץ, כל הדיונים האלה למעשה דיונים אתיים ומשאביים.
אחד הדברים המרכזיים ביותר זה עדות הציבור והקרבה למקבלי ההחלטות. אנחנו יכולים לבצע מחקר תיאורטי דמנטי סטטיסטי ברמה גבוהה ביותר, ועדיין התוצאות שלנו לא יישארו במסגרת האקדמיה בלבד.
האתגר של עדות הציבור להפוך את
Because of the shortage of time, let's start. It's a wonderful movie. I will distribute it, and I really recommend to see it. But I must say, although it's catchy and with the music and the different faces, and we also have for the students, by the students, okay, and we see the diversity and we see young people. Still, this is a bit of old marketing. People nowadays have short clips on TikToks and different things, not this kind of still more conservative kind of marketing. We established a team of public health influencers. Also, there is a team from the Minister of Health, which is wonderful, not related to us, but we established a team, and we got very wonderful team of young people that are motivated to promote the vision of public health. They are active on Facebook and on TikTok. We did a TikTok workshop, somewhat of a cultural shock, at least for me. But we try to provide the tools for the influencer group, and there are various clips that we promoted via TikTok. Again, promoted without much funding, of course. It's still we aim to simplify a complex subject, to connect to a new audience, to create a buzz, to connect to younger generation, the younger generation to public health. Again, it's very difficult, and there is a change of generations. The motives, but we need to speak with their voice. And for example, as we see that young people are very much concerned about climate change, they should be also very much concerned about public health, and we should get them on board. You can see again, I will walk a bit quickly, but this is from Ashkelon. Tips from the Ashkelon College. How to keep your health. This is the program for the first degree in public health in Ashkelon. And also this is from Zohar. So we learned that this kind of language, and again we can share the movies with you. And this is just the beginning. As Nadav said, we need to discuss here about the sustainability of the project. It's not very expensive, I must say, but we don't have even this seed money to do that. So we need national program. It's not specific for each school. We need national program to attract people to public health. So we need to see how we progress. We heard that we have this extra 6 months. It's good, but we really need to work on sustainability. We need to create content all the time. And all the time there are things that are going on. Today, a journalist, Arnon Sigal, said he donated a kidney, which is wonderful, but he said that he would donate it only to a Jew when he gave the donation. And that's against the principle of equalities that we public health professionals believe. Again, not to attack, but we need to see how we provide a different message and to use this opportunity to attract people or to get people to understand what is public health, strengthening the group and the network of influencers, echoing each other, how we make impact not only on social network, but actually to get people to register to public health education, to work in public health, and to identify themselves, because also we saw that public health nurses say first, I am a nurse, which is great, but they don't necessarily identify themselves as public health nurse. Sustainability that we are going to discuss, the lessons that we can discuss from this project. I must say, I did not engage with TikTok personally. I don't see how I can do it. I'm good in other things, but we need people that can do it in TikTok and in all the other platforms. In LinkedIn, for example, we are not active nowadays, and it's not about the platform, it's about investment in that. So we are going to discuss together how to promote. And I must say, I'm sorry that I took an example from the Hebrew University, which I had, but I know that also Haifa and Ben Gurion and Tel Aviv and Ashkelon are already using the lessons and the materials that we provided. You see here, come to influence, come to change. For example, with the cancellation of the sugar drinks tax, which is of course completely irrational from public health point of view. And again, I don't want to get much into that. I just want to say that we are at the time to change now. Now many healthcare professionals understand the value of public health, and this is an opportunity to get them to get on board in public health. So I will end with that and leave for the discussion. Thanks a lot.
Thank you, Chagai. So we got the whole full picture of the project. We are entering now to the third final year. We still need to move forward with the leadership component to have it integrated. And I think this is very much related to the core business of Council for Higher Education, because it's about curriculum change and thinking about simulation and PBL and all of that. And in general, it is clear that we don't think we're going to end the project, and that we must continue. Again, we were sitting in this room, Professor Mekori, about, I think 5 years ago, when we had a formal discussion of the evaluation of all schools of public health. And there was lots of energy to have the Council for Higher Education as a platform to continue these meetings. The current schools that participate are those that are members of ASFER. But of course, we need to have on board Tel Aviv University. I mean, Rachel is here, but we were trying, I can assure you. And from different reasons, they were not so much interested, but maybe this can be changed. And there are many other programs. Maybe Al-Quds University. Yes, we can. We tried that too. Yeah, right. Laurie is still here with us. And of course, we'll continue to work with ASFER. There are lots of lessons that, again, can go back to the EU, but since we are now in Israel and in the Council for Higher Education, we'll be very happy to hear your thoughts. We want also to keep the door open because it's clear that we're not going, we are thinking that we get now all the solutions, but to start a process and a dialogue and maybe meeting, especially until the end of the project, at least 2 more times and having also questions from you and ideas. So the floor is open for discussion.
Words? Maybe I missed some information, but as part of the committee that Chagai mentioned, and looking at education of the medical students and the public health residents, we mapped all the curricula in each medical school in Israel with regard to what medical students are receiving throughout the years. And we did plan, Nadav, on a meeting with the forum of deacons and asking to create some kind of a baseline to assure that each medical student gets a minimum package of public health training. And also 20 years ago, I think the public health education was easy in terms that only in Jerusalem we had a public health school, and now we have several. But regarding our residents, I'm not sure that each of our residents, if they're trained in a different school of public health, they're getting the same package. So also in that respect, we need to standardize somehow the training of our residents and make sure that each of them is getting all the package that we think is mandatory.
Yeah, again, this is a sub part of what we're interested, working with physicians, but of course it's much broader. There's so many other health professions, but because of your previous experience.
But as you said, for example, the issue of ethics was really important to identify.
Mentioned that yesterday, we had the graduation ceremony of our Israeli master students, and 5 MD and PhD students graduated. We're hoping to expand that program soon. We're not talking yet about public health specialists, but at least for those 5, they're getting future.
In Tel Aviv, it might be that the 6th year of the the track of 6 year will be they'll be offered the opportunity to do an MPH, all the students. So that could be a great initiative.
We established when I was there, we established an MD and PH.
Yeah.
For how many other per year?
There are, it's growing. I think there are.
Ben-Gurion now we doubled it. It's now 30.
30 per year.
30 per year.
That's nice.
Yeah.
That's very good.
But now that we're changing the whole program for the 6th year, the 6th year will be, they'll be offered the opportunity to do an MPH.
It was fascinating and it was so interesting because I can take credit because I was the one to open the School of Public Health in Tel Aviv. Basically, I remember there were 5 departments there, or 5 plans. That was emergency medicine, like a crisis management. There was epidemiology. There was a health education. There was occupational health. And what's the 5th one?
Management.
So there were 5.
And I'm a graduate of the first core of the School of Public Health.
No, my time, no.
Of the school?
Yeah, in school. So I started it with Podcast. So it's very close to me personally, not as a chair of the PBC or the Planning Budgeting Committee, but the previous dean and of course the physician. I think we have to make things very clear. We in the PBC don't dictate any curriculum. It's a bottom-up system.
But we have the profession in it to do that.
Exactly. So no, but the point is that I cannot order any university what to do. The opposite goes. I mean, they come to us and ask for a new program, and it undergoes the whole kind of quite complicated process in order to be approved. or it can come from one of the governmental ministries. For example, the Ministry of Health can come over and ask us, to reinforce or to incentivize such and such, so forth and so on. So the point is that having said that, I'm not going to escape of being responsible for something, but you have to keep things in proportion in order to understand how it works. So right now it's a very interesting time because we are at the midst of, as you know, the PBC works on a multi-year program. It's not a yearly program. We do have a 6-year program. So each cycle, we do have a budget directly from the Ministry of Finance, not through the Ministry of Education. We are completely autonomous and independent to negotiate with the Ministry of Finance to get a budget. So right now, this year, we are at the beginning of the next 6-year program. It's already 5 because the last year, because of the restlessness of the governmental here and the governmental situation, the political restlessness, basically we start now for the next 5 years. So next 5 years already closed. The point is that I think while talking to you, right, hearing you, how can we get a little bit closer to your ideas and thoughts and concerns? Because you must realize it's not only shortage of physicians, there's a severe shortage of health professions.
Right.
Communication skills like communication therapy, occupational therapy, and physical therapy. And our problem is that you don't have faculty to open new programs. In order to open a new program, you have to have at least 3 PhDs to have a faculty level of at least a senior lecturer. So basically non-existing. I wanted, when I was in Tel Hai for 6 years, I wanted to open a communication department or communication, what do you call it, alphabetic shorthand.
Teach
therapy.
Yeah, it's for the communication problem. And basically, I couldn't find any one person who has got a PhD from Haifa to Metula. The whole course, there was nobody. So and we are trying very hard the last 3 years to open new programs. First of all, to increase the present ones. On top of it, to try to open new programs in health professions in the north and the south. We are not able to do that because there is no one PhD who can take over and start such a program. We need 3 of them to have the degree of at least senior lecturer. So it's a major problem we are facing. I got it. I'm here in this position only a year. I got a year and a half. So basically, I got these problems, and basically, the way to do it is that to join forces with stakeholders. For example, in this case, the Ministry of Health. So I'm thinking of occupation. I'm going to employability. I'm going to talk a little bit later on. But right now, at the beginning of this multi-year program, this 5-year plan, I can tell you that the thinking of you, we have, first of all, we are talking about changing the curriculum of medical school. And the curriculum of medical school, one of the items there is to go out to what you call community-based medical education. Community-based basically can also involve what's going to be the exposure of the students to public health. So right now, that's your time to go to the deans of medical schools because we are going to work on the new curriculum in this coming September, starting on this coming September. We are talking about shortening it from 6 years to 5.5. There are a lot of ideas, but the point is, where is public health getting mingled into or adopted into the curriculum of medical school? So that's why to go. That's one way to go, and to embark on the idea that we are in a very critical point of change, or changing basically point, because we are going to revolutionize all medical education in Israel in terms of the curriculum. So that's the first thing. The second thing, we basically decided to invest quite an impressive budget into the idea of creating clinician scientists. Now, clinician scientists, basically, we're talking about clinicians who still, on one hand, they have this bedside involvement, taking care of patients, but embarking on research. Now, we have several plans for people like you guys, the young ones, the young generation, to basically take advantage of this program. First of all, we have a special program for stipends, for fellowships, for residents who would like to do at the middle of the residency, instead of half a year basic science when they saw to have a year and a half, we are going to pay for it. And they can basically choose any research they would like to, either in basic research or epidemiology or public health. And I already talked to the ISF, to the Israeli Science Foundation, who is going to operate the whole system, to consider also public health and epidemiology within this whole project.
It's very important because
let me tell you, that's it. And basically we are going to invest $500 million shekels. Second, we are going to have special research fellowships for attending physicians, namely for mumchim. For those who finish, they're finalized and concluded their residency and would like to embark on some research career, but they are not able to go abroad to Europe, to the United States to get the research fellowship, they can do it here. So, and the idea is they're going to still keep in contact with the hospital or clinic, just for example, one day a week, and the rest of the time they're going to spend in the laboratory. We are going to cover expenses for the salary for 3 years. So that's another way to go over and to get involved public health into the program. And the third one, this is one flagship plan for the next 5 years. The other one is sustainability. We met about it several months ago. And once again, you can consider just taking advantage also of this flagship project of sustainability. Sustainability, we are talking on energy and climate. You can be involved in that. On the sea and water. But the most important one is biological diversity and food and nutrition. Food and nutrition. So remember, so I'm kind of thinking right now, without knowing that I'm going to lecture, I'm going just to come and listen. So that's another way you can get involved in. Just open your eyes and ears whenever we are coming out. Everything is competitive, of course. Nothing here is allocated budget, just competitive for the university. So do it through your universities. Now, the last thing is employability, is employed. We are in charge only of academic institutions. We don't have anything to do with employment. That's basically the role, the major role for the Ministry of Health. But let me tell you what I told them. When I talk about the other health professions. For example, they can give universities special fellowships, stipends, manakim or melabot, for students who are going to embark on career in public health. For example, if you're going to join Ben-Gurion University in public health, you're going to get a nice stipend if you're going to embark on a direct track to PhD. That's the way to go. That's the way to go, because we subsidize, we incentivize the university. But we cannot incentivize a student. But a student can get, for example, I can direct the money that I get from Ministry of Health for special stipends in medical schools or schools of public health in order to divert or to convince students to embark on such a track. For example, Directorate to PhD in public health. So that's the way we can work on. That's the way I'm doing it with Misrad Abiyut, with the Ministry of Health, talking about health professionals, medicine, of course. For medicine, another issue, because we are focusing severe shortage of physicians, and we are going now. It's going to be opening new programs and mainly enlarging extending the current medical schools. So that's the way I would go. So it should be a coordination between the stakeholders, and as far as we are concerned, is Ministry of Health and us, in order to work together and to see how we can give you some support and help I definitely in solving a quite, I would say, significant problem you just raised. I mean, you just presented. Definitely, we are very aware of that. That's the way we can get it.
First of all, this is amazing, and it's really important for us to be aware of all these changes.
I would advise, excuse me, Judge, for interrupting. The last thing, there is a lot of money that you are going to divert into the ISF for just research grants. And I already talked to them. We had a meeting just last week that epidemiology and public health is going to be found. It's not going to be only basic research. It's not only laboratory research, it's going to be also research in public health, because the idea is what we call MAVRI. And MAVRI is basically the clinician scientist, which has not been formatted or haven't been officially recognized here in Israel. But we would like that within 5-6 years from now to start see the first generation of a formative, officially recognized clinician scientists. So there are going to be also fellowship, or once again, competitive grants for basic research in public health, epidemiology, so forth and so on. So you have also to be aware of that.
What about international collaborations? I know that you're dealing with that.
We do have a Department of International Affairs. Nomi is not here. She's now meeting with the Minister of Higher Education, the Italian one, that just is visiting Israel. And Nomi is right now in Tel Aviv. We do have international in Department of International Affairs, academic international affairs, but that's basically once again for universities. So the university does have a budget allocated from us and directed from us for international affairs.
I want to give you an example of Italy, if you mention. In Italy, universities are controlling the medical specialties. Every year you have 400 public health physicians entering the system. We had in the past discussion and brought Walter Ricciardi was then the president of the European Public Health Association, later of the World Federation of Public Health Association. In the UK, for example, they also had a major crisis, and then they opened it to non-physician. It's a different solution. What is your take about the role of universities in medical specialties?
Personally, I definitely would prefer to have it, but as you know, there is now a big.
Yeah, exactly, because you're
I would say, kind of controversy. This is an understatement
between
the INA and the Minister of Health. So basically, we are supervisors. We are in charge of only making a physician. But whenever, as you know, whenever a physician gets his MD, basically that's the end of our role in creating in this process, and the rest is the Ministry of Health and the INA. Specialty, or some specialty, basically are completely controlled by the IMA and the Ministry of Health. We don't have anything to do with that.
In continuous medical education, also, because universities are involved.
Completely, but they are completely independent. They're completely independent. They're basically a closed market. They basically cover their expenses, and basically we do not control the CMEs, the continuing medical education. It's completely governed by the universities and the IMAs, the different specialties. For example, family medicine, they do have to have CMEs. But basically they are the one to control it, to recognize and approve it. Nothing has to do with us. We are controlling and supervising only academic.
But maybe that's something to discuss, or
we discuss it. It's a history right now. It's the Ministry of Health would like to take it, and IMA refuses. So basically, there is a big quarrel between the two organizations.
But can we build a different model for public health with the schools of public health for continuing public health education?
Who gives the license for?
There is no certificate for public health professionals.
Okay, so that's the point. If there is no license, so if there is no certificate, basically it can be perceived such as the other health professions.
one of the results that we're such a small profession, there are few people who do everything basically, and the load is enormous, and therefore things are not moving maybe at the pace that we would like them to move, and there's a lot to do. And my question is there a way that the Malad will support us in our activity? Because I think financial support and some kind of a support will help us to broaden our activities and to be more effective.
I have to explain something. Everything's very formalized here. We do not have a budget to spend upon request. The budget is basically based on output and Foucault. So basically the university get the budget only at the end of the academic year, according to what they have been achieved. That's true for how many students they taught and what research activity they had in terms of, and there are very complicated formulas for them in terms of what they published, where they published, what kind of competitive grants they got, they achieved, and so forth and so on. We do not have anything competitive. So I do not have any one shekel for demands or requests by certain organizations. So everything has to go to the university. That's by law. That's by law.
I do want to stress, to emphasize the opportunity here, because unlike with the speech therapist, for the schools of public health in Israel, there is although limited in resources and number, but excellent in its academic performance, with really world class, as you know, in grants and publications, etc., from the schools of public health, well known around the world. And also it's expandable, because we already have very successful PhD programs, and we can, you know, develop the future stuff. We can enlarge the staffs of the schools of public health much easier than in the other fields that you mentioned. So we have good infrastructure. The problem, what you said, of course, is remarkable, and your personal leadership is really needed, because in some places still there is a false impression of inferiority of epidemiology compared to basic science, which is, of course, just not understanding what is the importance of epidemiology, and also specifically in the current world, prevention is essential. Okay, I mean, we really need to focus on that. We are very good also with the international collaborations, and the same questions also appear in other countries. So we can see what are the models in other countries, and they can learn from our experience. We can learn from their experience.
A way I can see it, and in terms of the working with you in the future. Once again, my basic concept is that it's of utmost importance and significance, public health as a profession and as a discipline. One way that I can think of it is just to meet with you guys from all schools of public health, all of them, should be all of them, all university one, and of course colleges, because we are governing only the public schools in Israel, public institutions, no private ones. So only public universities and only public colleges that do have school of public health get together. You know, I can invite over the appropriate representatives of the Ministry of Health, and we can sit together and see, you know, how we can undertake some steps forward in order to assist you. Right now, unfortunately, it has not been included in our multi-year program, which already started, as I said, several months ago. So, but you know, if the Ministry of Health see kind of importance that he can be involved, you know, we can look at it as we look for some processes that we are undertaking right now with other disciplines.
There's another interesting thing we are working now, and Haifa already did it, is to have all of the public health districts affiliated from an academic point of view to the universities, like hospitals are. I think this would be very important for your plan of doing reform in the medical education, because such a place, including the mother and child healthcare centers and other activities, it's a very interesting clinical field or public health field for medical students. And we have, I wonder if that's something also that we can discuss together. All of us are doing it on the university level and trying to promote it. Sharon Alroy, that is not with us, is also very in favor. But that's something that
Sharon is from the Minister of Health, so maybe she can.
Yeah, unfortunately on the flight, but Elad is here. I hope that Elad can respond or deliver the message
from the Minister of Health, because you have to understand that we have a tariff, price tag for each profession. That's the way the PBC incentivize and they build the budget with the university. We don't have a budget.
That's interesting. What is the budget for master in public health? Is it like a regular master or like a professional?
Very excellent questions. I want to ask Sigal. We have to look at that.
Yeah, because if the university will get it instead of X, 2X.
They do give 2X. In comparison to other MPH?
No,
in other fields?
No. MPH compared to master in physiology. If the university would get 2X.
I have to check.
I don't know compared to physiology, but compared to completely different.
Maybe that's social science, to philosophy.
So you do get more.
Yeah, more than philosophy.
I can tell you.
Yes, it's about 2X.
But
so that's the way it was. That's where it goes. So and it goes to the university. And the university not necessarily transfer it to specific school.
Right.
That's the way it goes. So basically, if it's about 2X, that's exactly what I wanted to have. So that's okay. So that's the way we work. I mean, we don't have special budgets for projects or something like that, except for the I would say the very basic of such physical building, like facilities, infrastructure, equipment, and of course teaching. We do not have specific budget which is allocated for specific faculty to do something specific. That's not the way it goes, unless it's competitive project. So if it's competitive, so there are some faculties and departments who are going to be successful in this competition will get it, the other ones not.
For the data science program, for example, right?
Data science, basically the money came from the government.
Yeah.
Government decided that enforced us, not decided, enforced us.
And what does it include? For example, the pillars of
it included quite impressive, significant of budget per each student, but money goes to the university. For the university, in order to enlarge, to significantly increase the numbers of available positions for faculty and for students in computer science.
Is there still a possibility to have, like in the data science, also to think about epidemiology?
It depends on as far as I know, the government did not include epidemiology inside. Everything was basically on top down. It came from the Prime Minister, the Ministry of Science and Technology. And we were partners, but basically we were kind of minor partners. It basically was, as a matter of fact, decided by a specific committee. The committee decided that the relevant professions would be computer science, electrical engineering, math, and statistics.
I would like to say something about the scholarships and grants that you mentioned.
Yes.
I think it's crucial that we would have more funding in these terms, because the competition with the basic science is impossible. And in most grants, we feel like the underdog. We apply to a lot of grants, right? but the competition with basic science institution is almost impossible. So practically, the funding that we can get for public health research, my field is nutrition, so more so for nutrition research under the roof of public health is extremely difficult. And I can tell you that research is dying. I mean, we don't get.
It's much easier in NIH. They are much more pro public health than the ISF.
I can talk. I talked already with the ISF, as I told you. The ISF is operating. That's not us.
Yeah.
The ISF is operating it. I'm just. I'm going to we are meeting on a regular basis. That's something that I can bring.
Just to make it clear for you, when you approach the ISF, there is some improvement because there is a public health section added recently, right? Which is very good, but it's still not enough.
It comes from social science.
Remember that right now they have, on top of the regular grants, they are going to have special program for medicine, for medical professions.
But there are other medical professions, not just MDs. Just need to remember that. Okay, so it's a wider. Okay,
and also the National Institute.
And in terms of MDs, if you need the money, you can just put one MD on your proposal, just in order to get it funded. I don't like to tell you.
But I'm not sure this is the best.
Just to put the name there, so or some collaborators going to be an MD, just in order
if
to.
You know my history, you know I have a lot of MD on my proposals. So.
But there are.
No.
Can I say a word?
Only want to say.
Okay, so few remarks. First of all, I think that. Is there an echo or something? No, okay. I think Professor Mekori's, Yossi, your ideas were fantastic. And I think part of the thing is us. We have all the time to be vigilant and to look for opportunities where we can add the public health into all those, I would say, coming up centers, grants, etc. So this is A. B, you should remember that we in the National Institute of Health Policy, at every point in time, we fund 100 studies. It's not a small number, and quite many of them are in public health. There are others which are directed more to health economics or more, I would say, specialized in policy, but many of them are public health in the broader sense. I think that what we should fight for is that there will be some centers in the universities. There were centers focused on environment. There are now centers for data science, and I think we should be in the government with the ministry. Sharon is now pushing this idea of intelligence in public health via a lot of big data. So we should think that coming up, it's not a year, it's more, but we should try to convince the government that centers and that the university will compete and will organize centers for public health in the broader sense that will include ethics and will include big data in public health and artificial intelligence in public health and all this. And I think this is should be the way to go. I have many other comments, but I thought that these few points will be first.
I completely agree. Yeah, definitely.
Elad, you wanted to comment?
Yes, I do. But before I do, Ilana has to come down, and I want her to talk about nursing, modern nursing stations. So, Ilana.
Elad, Professor Mekori need to leave, so it need to be very, very brief because the meeting is until 12.
We have 2 minutes.
Then I'll be short. About branching with the universities of our districts. We pushing for this with you, and we think it's super important. And for the budgets, both salaries and other opportunities that we have now in public health, we're doing the most to get what we can from the Ministry of Treasury, and we have some successes here that we'll hope we'll see them in the next year. That's it.
Thank you, Elad. I want to thank Professor Mekori.
Thank you very much.
And if you have some time, Sigal and Eti, we can discuss also the implications on quality assurance and accreditation, because we didn't touch upon that at all.
Something what you did is so important for us, that's basically just to formalize and format the idea of quality assurance.
We'll send all the publications, the peer-reviewed publications that emerged already, about 4 or 5, and
Yossi, as you well know, many times our standards and way of work, other people can copy, and many times you see these very useful tools.
And we will do our best to coordinate and help all the follow-up meetings and ideas that came up during this event. And Nomi told me, don't count on it that you're going to stay the full 2 hours. And I said, okay, but yeah, I appreciate your time. Your time is very precious. And yeah, and you, as in your former position in Tel Hai, you're aware that the Erasmus Plus project, like they have this ability to fund projects that.
I'm telling you, medicine is going to be on the table within the next year or 2. There's a lot of noise there. You see that even the mayor of Elad decided he's going to open a medical school. Everybody opens medical school. It's a kind of a chaos right now. We have to take care of that, and you should be there. Definitely, you have to talk to the deans, and you have whenever you are independent, because in Tel Aviv the School of Public Health is under the Faculty of Medicine. Not every university has got a faculty. They do have schools. So just be careful and be aware of the fact that there is a lot of is going to go and happen within the idea of creating new curricula in medical education, so forth and so on, and you should be partners.
We also had a meeting with Harry on Sunday on the education of nutrition to medical students. This was one of the topics.
That's absolutely something that is missing. Medical students don't hear anything about nutrition, unfortunately.
Yeah, minor topic.
Yeah, I know, and I'm very aware of that. I was there, so.
And following the question, public health is a part of the pre-med other fields. Yeah, other pre-med.
הם מקבלים כמו ביולוגים וכולי.
אז זה טוב.
זה טוב מאוד. זה טוב מאוד. אתם מקבלים...
תואר שני בבריאות הציבור.
It's the same, yeah, it's different than nursing or pharmacy, but it's the other pre-med fields.
אז מבחינה זו, האוניברסיטה מפוצה, אתה אומר אותם בעברית, אני לא רוצה שתשמע את הסיפורים שלך. So the university is quite well compensated. Definitely, there is a need for more than that. But once again, the idea is maybe to invent something new, to go into some kind of new, more appealing, as you say, more appealing, more
the data science is one.
Data science now is a
climate change,
which is going to
sustainability,
innovation
is very hot air, but
that's the way to go.
Important. Thank you so much, Professor.
Thank you so much.
Thank you.
Thank you very much.
Thank you, everybody.
Thanks a lot.
Thank you,
Lord.
Larry, Karen, Orly,
Bye, guys.
Maureen, Nachum, Elad, for staying with us. Thank you.
יופי. חגי ונדב, עלו לי כמה רעיונות בראש, אז בהזדמנות נגלגל אותם.
בסדר גמור.
טוב. טוב.
אני כן רציתי להבין